Hi everyone, I'm Dr. Aleksandra Brown. I'm a board certified dermatologist and welcome back to my channel. Today we're going to talk about rosacea. What is it, what causes it, and how to manage it. Rosacea is a chronic inflammatory skin condition that can cause persistent redness, visible blood vessels, and sensitivity. It often comes and goes in flare-ups, and there's really no cure, but the right routine can help keep your symptoms under control. So if you find this video helpful, please like, subscribe for more skincare insights. And let's dive in. So what is rosacea? Rosacea is a chronic inflammatory skin condition that primarily affects the face, causing persistent redness, especially on the areas like cheeks, nose, forehead, and chin, kind of like the midline face. Some can have flushing and increased sensitivity. There's also a component of visible blood vessels, we call it telangiectasias, but some can also have small pimple-like bumps that almost look like acne. This is called a papulopustular rosacea. Thickened skin is also present in more severe cases, such as around the nose. This is called rhinophyma. Rosacea tends to develop between ages 30 and 50, and it's more common in fair-skinned individuals, but really anyone can have rosacea. And while rosacea is not fully understood, research suggests that genetics, immune system overactivity, and environmental triggers all kind of play a role in different variants of rosacea and rosacea development. There are 4 main types of rosacea, and even though there's 4 types of rosacea, most patients come with maybe a couple of different symptoms. They don't necessarily have like a one individual type. Most of the time, if you have rosacea, you're going to have multiple of symptoms from each of these categories. So first type of rosacea is erythrotelangiectatic rosacea, or ETR. This type is characterized by persistent redness, flushing, and visible blood vessels, or telangiectasias. The skin often feels really sensitive, may feel like it's stinging or burning. Next type is the papulopustular rosacea. This one's often mistaken for acne. This type causes red, inflamed bumps, we call them papules, but also causes these pus-filled breakouts, we call these pustules. Unlike acne, there's really no true blackheads or whiteheads, and skin is often very sensitive. That's one way to tell rosacea from acne. The next type of rosacea is phymatous rosacea. This is more advanced form where the skin gets really thick and becomes bumpy. Often occurs on the nose. We call this rhinophyma. Over time, it can create more like a bulbous, swollen appearance. And the last and 4th type of rosacea is ocular rosacea. The ocular rosacea can concomitantly be present with either erythrotelangiectatic or papulopustular, or you can maybe have all 3. This type affects the eyes, causing redness, irritation, dryness, sometimes swollen eyelids. Some people mistake it for chronic dry eye or allergies. I personally have rosacea, and I have ocular rosacea, so sometimes eyes feel like they're watery, other times they feel like they're really dry, gritty, have sand in them. I also get broken capillaries and pimples, so I can relate. If you have rosacea, make sure you stick to the end of this video. We're going to discuss so many different options. Now, if you have rosacea, there's some common trigger factors that you should be aware of. Certain triggers can cause flare-ups by increasing inflammation and dilating those blood vessels. And while triggers vary from person to person, some of the most common triggers for literally everyone with rosacea are things like sun exposure. So the number 1 trigger for most rosacea patients, it's UV rays. They cause inflammation, so daily sunscreen is essential and step 1 at treating rosacea. Other trigger factors are things like heat and cold, so both hot temperatures and cold wind exposure can cause flare-ups. Spicy foods, hot drinks, foods like peppers, caffeine, alcohol, they can all dilate blood vessels, causing flushing and worsening redness. Alcohol, especially red wine. Alcohol is a vasodilator, meaning it expands the blood vessels, making flushing worse. And then things like stress and emotion, so increased stress can spike inflammation, leading to more frequent flare-ups. Harsh skincare products are another contributor. Things like fragrances or alcohol-based toners and aggressive exfoliants can totally weaken your skin barrier and trigger your rosacea. And then there's that little pesky Demodex mites. So some rosacea patients have a higher number of these microscopic mites, which may contribute to inflammation. A pro tip here is keeping a trigger diary that can help you figure out what specifically worsens your rosacea. So just because you have rosacea and alcohol and caffeine are trigger factors doesn't mean that you need to avoid all of it. You should figure out what your trigger factors are before you eliminate them. So you might say, my skin is so sensitive, I have rosacea, I just can't use anything, but you can. We're going to dive into some skincare for rosacea, what types of ingredients you're looking for, and what types of topicals you may want to use or avoid when you have rosacea. So step 1, when cleansing, start with a gentle cleanser. Cleansing is a crucial first step in any skincare routine, but for rosacea-prone skin, it is essential to use non-stripping, fragrance-free formula that's not going to disrupt your skin barrier or cause irritation. A good cleanser should remove all your dirt, oil, impurities while keeping the skin calm and hydrated. Of note, if you have super sensitive skin and you're more on the dry side, you can either skip the morning cleanser or just use water, or you can use gentle micellar water if you want to. For cleanser, I would suggest maybe starting with the Vanicream Gentle Facial Cleanser. This is a soap-free, oil-free, completely fragrance-free formula. It's ideal for those sensitive and allergy-prone patients. It removes impurities without over-drying your skin. It also gets seal acceptance from the National Eczema Association, so it's ideal for your dry skin. It is non-comedogenic, so it's not going to clog your pores if you're unsure if you have rosacea or acne and you're worried about this. There's no harsh cleansing agents, and it is completely pH balanced. It's also free of dyes, fragrance, lanolin, and parabens. Some key ingredients here include things like cacamidopropylbetaine. It's a mild surfactant that gently cleanses without irritation. Glycerin, of course, one of my favorite humectants that draws moisture into the skin, preventing dryness. It does have purified water in it, which will provide a clean, hydrating base for the formula. Another cleanser I recommend often is a Cetaphil Gentle Skin Cleanser. This is an ultra gentle, non-irritating cleanser. It's suitable for sensitive and eczema-prone skin. It maintains the skin's natural moisture barrier. The key ingredients here are things like water, cetyl alcohol, propylene glycol, sodium lauryl sulfate. I know they sound like big words and they might be irritating, but it is super gentle. It will not irritate your skin at all. It is also completely fragrance-free, and it does a good job at removing all the skin impurities and leaving your skin hydrated and your skin barrier protected. The step 2 in rosacea skincare is antioxidant protection, and my favorite antioxidant is, of course, vitamin C. Some rosacea skin is so sensitive, and I often get comments from you guys saying, I can't use vitamin C, I'm allergic to it. It might be that maybe you just didn't get the right one. Vitamin C is a powerful antioxidant. It helps protect the skin from environmental stressors like UV rays, pollution, which can trigger rosacea flare-ups. But not all vitamin C serums are created equal. Rosacea-prone skin benefits from gentle, stabilized formulation. My recommendation for vitamin C, especially if you have rosacea-sensitive skin or if you're a beginner, is Vanicream Vitamin C Serum. This one's designed for sensitive skin. It's stable vitamin C serum that brightens the complexion without any irritation. It will help prevent that oxidative damage that can worsen rosacea symptoms. It is super lightweight, non-greasy, absorbs really easy. The key ingredient is the tetrahexyl decyl ascorbate, or THD 5%. This is a lipid-soluble form of vitamin C that penetrates deeply, promoting collagen synthesis and providing antioxidant benefits. It's a gentle, stable, non-acidic, so it's ideal for that really sensitive rosacea skin. It also contains ceramides, which will help reinforce the skin's natural barrier, locking in that moisture and protecting against external irritants. It has the glycerin, which draws moisture into the skin, ensuring it remains hydrated, soft, and smooth. When it comes to vitamin C's, another often recommended vitamin C that I use in my practice for my patients who've done laser is the Skin Better Alto Advanced Defense and Repair Serum. This is a really potent antioxidant. It has that THD vitamin C, which is lipid soluble, really good for sensitive skin, as well as complex of other antioxidants to keep the inflammation at bay. So for my patients who are coming in to do pulse dye laser, which I love, it's my favorite laser. I do it several times every single day. I always tell them that if you're investing in the laser, you need to protect that investment, and every pulse dye laser patient should be doing a vitamin C for sure. My number one recommendation is the Skin Better Alto Advanced. If you are looking for a more budget-friendly option, I would stick with Vanicream. Step 3 in rosacea skincare is hydration and barrier repair. Since rosacea-prone skin often has that compromised barrier, using soothing, hydrating moisturizer is really the key in reducing the inflammation and preventing any flare-ups. The best options here are going to contain things like ceramides, peptides, calming ingredients like niacinamide and Centella asiatica. One recommendation I have here is the Avent Cyclophat Plus Restorative Protective Cream. This is a really rich restorative cream that helps protect and heal irritated or compromised skin. It will soothe the redness and inflammation while supporting skin barrier repair. It is suitable for extremely sensitive skin, including rosacea and post-procedure care. The key ingredients are here. It has the C+ Restore postbiotic restorative ingredient. It is super rich in proteins to help restore the skin barrier. Also contains the copper zinc sulfate. This helps promote and maintain a healthy skin environment for optimal recovery. And of course, it has the Avent Thermal Spring Water, which is rich in antioxidants to calm and soothe irritation. My next recommendation for a product here would be Dr. Jart Plus Cicapair Sensitive Skin Moisturizer for Redness. This is infused with Centella asiatica to calm redness and irritation. It hydrates and strengthens the skin barrier while providing that super lightweight coverage. It also has color correcting properties which will help neutralize some of the redness for a more even complexion. The key ingredient here is the Centella asiatica or the Cica complex. It's a powerful anti-inflammatory ingredient that promotes healing. It also contains the niacinamide, which will help reduce the redness and improve oral skin texture. And there's some tiger grass extract that will strengthen the skin barrier and calm irritation. And the step 4 in treating rosacea are targeted treatments. So rosacea treatments should focus on calming inflammation, reducing redness, preventing the papules and pustules and bumps that we get. So ingredients that would be helpful here are things like azelaic acid, sulfur, and then gentle retinoids to help manage symptoms effectively. Azelaic acid is one of the most common effective ingredients for rosacea. It helps reduce redness, inflammation, even some bacterial overgrowth while brightening the skin at the same time. A product recommendation in this category is Paula's Choice 10% Azelaic Acid Booster. It helps reduce redness and inflammation while brightening the skin. It is really lightweight gel texture that layers well with other products. It also contains salicylic acid for that really mild exfoliation and to help unclog pores. The key ingredient is azelaic acid 10%, which will visibly clarify uneven skin tone and brighten dark spots and fades some of those post-acne marks that we all get. It also contains the salicylic acid or BHA beta hydroxy acid at 0.5% concentration. This will penetrate into the pores to help smooth that bumpy texture. And it has the licorice root extract, which will calm the redness and soothe signs of sensitivity and visibly brighten the skin. My next product recommendation here is the ordinary azelaic acid 10% suspension. This is a budget-friendly alternative to reduce the redness and even out the skin tone. It targets those rosacea bumps while keeping the skin smooth. It is super lightweight, silicone-free formula. The key ingredient here is the azelaic acid, which will brighten the skin tone, improve the evenness of skin texture, and reduce the look of blemishes and offer some antioxidant support. Also has a little bit of a dimethicone. This will provide smooth, that non-greasy finish. My next product recommendation here is the In Beauty Project Calm the Red Down Dual Chamber Redness Treatment Serum. This is a new product and it's super cool. It has this dual chamber, 2 formulas in one product, treatment serum and redness corrector. It targets redness, blotchiness, and atopic skin or really dry, sensitive, irritated skin. The dual chamber treatment provides instant redness correction and long-term results. The key ingredients here are the hexapeptide 9 and biomimetic peptides. These are patented peptides shown to nourish skin barrier and reduce redness. It also contains 5% azelaic acid, which will calm effects of stress on skin, visibly reduce the redness and bumpiness of the skin. There's some snow mushroom and centella stem cells, which will provide boost of hydration and support the skin barrier. The next ingredient to consider adding to your rosacea skincare regimen is probably my favorite ingredient, and it's sulfur. Sulfur is a really great option for rosacea. It has antibacterial, anti-inflammatory, a little bit of antifungal properties, so it'll help with those pustules, irritation, bumpiness. Really, it's my go-to. My favorite here is the Peter Thomas Roth Therapeutic Sulfur Mask. You guys have seen me use it for like so many things: rosacea, sebaceous oil glands, sebaceous filaments, acne around the hairline, you name it. I have found a use for this product. It works by absorbing excess oil and reduces inflammation, so it can be used as a full face mask or spot treatment. I tend to spot treat my whole face, if you will, about once every 10 days. The key ingredients here are 10% sulfur, which will visibly diminish blemishes. It has kaolin and bentonite clays. These absorb the excess oil and address the issue of the clogged pores. It has a little bit of aloe vera, which will help calm and soothe over-treated skin. The next recommendation in the sulfur category is Delacruz 10% Sulfur Ointment. This is more of a budget-friendly sulfur treatment option for the pustular rosacea, the bumps that we get. It's super fast drying, effective for reducing breakouts. The key ingredient here is the sulfur 10%, which targets the inflammation as well as the excess oil. Step 5 in treating rosacea, and this could be controversial. To me, step 5 is a retinol. And I say it could be controversial because retinols are known to irritate rosacea skin, but I also have my 3 non-negotiables in skincare, period, and that's your SPF, your retinol, and your vitamin C. So I do think, as someone who does have rosacea, I do think that we can find the retinol that's right for us. It's just a matter of finding that right one. Retinol can be very beneficial for rosacea-prone skin when used correctly. So it helps promote the cell turnover, reducing inflammation, and improving skin barrier function over time. Many retinoids are too harsh for rosacea, but if you find that gentle formulation, you can get benefits without excessive irritation. Because rosacea skin is highly reactive, it's important to use a gentle formulation with soothing and hydrating ingredients to minimize irritation. And if you're someone who has started retinol and you are not sure if you have rosacea, or if you have rosacea and you're like, I can't use retinoids, I'm just going to stop you right there, I'm done with this video, just listen to me. Watch my retinol irritation video. I'm going to link it up for you guys here. Just watch it. I describe different types of retinoids, how to start your retinoid, pea size amount, retinol sandwich, what does that accomplish, how often do you use it, how much do you use, which one do you pick, like all of it. So check out the video on retinol irritation so that you can get there. You can find the right retinol and how to use it to get the maximum benefit and minimal irritation. Now, if you're someone who's suffering from rosacea and you want to start somewhere, consider picking up the Event Retinol 0.05% cream. This is a retinaldehyde-based formula that provides similar benefits to retinol, but it's a little bit easier tolerated on rosacea-prone skin. The key ingredient here is retinaldehyde. It's more effective but less irritating alternative to retinol, if you will. It will help smooth the fine lines, firm the skin, support that collagen production. This also contains a little bit of hyaluronic acid. We all know by now that provides deep hydration. It will help plump the skin, give you that smooth texture to counteract some of the dryness. It also has a little bit of niacinamide. I love niacinamide. It helps strengthen the skin barrier, reduces fine lines, really calms down, soothes all that inflammation from rosacea. And of course, like all the other Event products, it contains the Event Thermal Spring Water, which is clinically studied for its soothing, softening, anti-irritation properties, making it ideal for rosacea-prone skin. My next recommendation in this category is La Roche-Posay Retinol B3 Serum. This is a slow-release retinol serum designed for sensitive and rosacea-prone skin, combining the retinol with niacinamide and then these hydrating ingredients to strengthen the skin barrier and minimize irritation. The key ingredient here is a pure retinol. It's a vitamin A derivative that promotes surface cell turnover, reduces the fine lines, improves the skin texture. This also has the niacinamide, which calms down the redness and restores the skin moisture barrier. Also helps fade some of the discoloration that's caused by inflammation. This also contains glycerin. This is a great humectant that attracts and retains water, ensuring optimal hydration, gives a little bit of plumpness to the skin. And then, of course, the La Roche-Posay Thermal Spring Water, which contains minerals and selenium, which provide the antioxidant protection and help soothe irritation. In step 6, and this is really probably, to be honest with you, the most important thing you can do for your skincare, for your rosacea, period, for your body, is daily sunscreen. This is essential for rosacea-prone skin to protect against that UV damage and prevent your flare-ups. Some recommendations here. You guys, if you're struggling finding sunscreen, and this is a lot of rosacea patients, make sure you check out my unbiased, non-sponsored sunscreen review series. I'm going to link up one of them here, but I've got like a whole playlist. It's just a matter of finding the right one for you. I'll mention a few here, but watch some of those videos and figure out which one is the right one for you. And then remember, you might want to switch it up from winter to summer. I often switch my SPF, very often actually, depending on what my skin feels like that day. I use everything from super hydrating to like mattifying ones. So find the right one for you and then use it every single day. I often get a question, what's the best SPF? It's the one you're going to use. That's all it comes down to. My first recommendation here is going to be the Alta MD UV Skin Recovery Red Color Correcting Green Tint SPF 50. This is a mineral sunscreen with a built-in green tint to help neutralize some of the redness. It's broad spectrum SPF 50, protects against UVA and UVB. It's super hydrating, lightweight. It's ideal for rosacea-prone skin. The key ingredient here is the 2% amino acid complex barrier repair technology. This is a patented blend of 3 amino acids that are proven to repair the skin barrier, visibly reduce the redness, and minimize the risk of irritation to help reduce that sun damage. It also contains the ceramide blend, which will nourish the skin and strengthen the skin barrier. Also has the Centella asiatica. This is a powerful herbal plant that helps calm sensitive or compromised skin. The active ingredient here is 12.9% zinc oxide. It's really gentle and sensitive skin. It's 100% mineral filter that will protect your skin from both UVA and UVB. And when you hear UVA, think aging, so it slows down the aging. And when you hear UVB, think burning, so it's going to minimize sunburn. So it does both. My next recommendation here is the CeraVe Hydrating Mineral Tinted Sunscreen SPF 30. This is more of a budget-friendly, also mineral that hydrates while protecting the skin. It provides that really sheer neutral coverage that evens out the redness. It's completely fragrance-free, suitable for sensitive skin. It comes in 3 different shades, so you can pick the right one for you. And I'm a big fan of mineral sunscreen, especially if you suffer from melasma. This is a good one to try. The key ingredients here are titanium dioxide and zinc oxide, so it has both mineral ingredients. These mineral filters block both UVA and UVB rays with minimal irritation to the skin. This also contains niacinamide, which will help calm the skin and support the barrier, reduce some of the redness, and then ceramides, which will help restore your skin's natural barrier, helping to keep the moisture in and harmful elements out. Another ingredient here is the hyaluronic acid. This is essential for maintaining skin's moisture balance, and it helps give skin smooth, plump texture. And one last pro tip, if you have an event and your skin is totally red and you just don't know what to do, here's just something that you can do for that event. I would not recommend doing this every day at all due to rebound redness, but you pick up Afrin, a little bit of that Afrin spray they use for nasal congestion, and you can spray that and mix it into your lotion and apply it to your face prior to the event. It should get you through the night. But full disclosure, you may get rebound redness. So rebound redness is where you wake up the next day looking worse than you did before you applied it. So I would only use this for really important events. If you have a ton of redness, you're experiencing severe flare, and you need that inflammation and redness to be gone like right now, like yesterday, and only temporary relief, and totally be aware the next day could be worse. Don't use this every single day. There is a warning on Afrin. You're not supposed to use it more than 3 days in a row due to rebound. I do think on the skin you'll probably experience rebound the next day, but try it if you have to. Do not depend on it. So when do you really consider medical treatments? For moderate to severe rosacea, topical treatments alone is sometimes not enough. So make sure you see your dermatologist if you're doing all of the above things and that's not helping. We do have other topical prescription medications that may be beneficial, such as topical metronidazole, which is a topical antibiotic, anti-inflammatory, topical ivermectin in the brand name Soolantra. This is an anti-inflammatory treatment that targets Demodex mites, which may contribute to rosacea. Well, speaking of the topical ivermectin, there are 2 tips over the counter. I'm just going to slide these in there with the Afrin. These are not medical recommendations, if you will, but these are tips I tell my patients if you're in a pinch. If you're trying to get ivermectin and insurance isn't going to cover it, and they often don't want to because Soolantra is very expensive, there are 2 different ivermectins over the counter that you can try. So you can go to Tractor Supply, yes, the Tractor Supply, and you can get ivermectin that's for horses, and we often recommend this in clinic for patients who absolutely cannot afford anything else. It comes in apple flavor, but it's my understanding it comes unflavored as well. You can use this on your face for severe flares if your skin is not too sensitive, because it is 5%, it could be harsh. And another tip is if you go to your local CVS, Walgreens, or drugstore, they have ivermectin in a light solution that you can use on your face to temporarily calm down the redness. This primarily targets the Demodex mites. So if you have a lot of bumps, papules, and pustules, it will help with that. However, if your main concern is just broken capillaries and you don't have any bumps, these are not going to help. When talking about topicals and talking about those broken capillaries, Mirvaso is a brand name for brimonidine, which is a topical vasoconstrictor, if you will. It's a gel that temporarily reduces redness by constricting those blood vessels. Of note, you may also experience rebound redness if you use this, and personally, I've really had struggled with insurance coverage on this one, so I don't know if you're going to get this covered. If your main concern isn't really the papules, the bumps and pustules, and the acne type of breakouts, if your main concern is the broken capillaries, topicals don't do amazing job. Nothing like lasers. In this category, we have IPL or intense pulse light and PDL or pulse dye laser. They effectively target persistent redness and visible blood vessels. These treatments also help improve skin tone over time, and the vessels work by targeting the hemoglobin and red blood cells, and they constrict that vessel, and you might be a little bit pink or a little bit purple for a few days, and then your body just reabsorbs that and the skin goes back to normal. But depending on what your genetic composition is, what your lifestyle is, whether or not you wear sunscreen and do your skincare, you might need a laser once a year or 3 times a year. I have patients who come in once every 2-3 years, and these are mostly women who wear sunscreen, work indoors, and then I have some male patients who work outdoors, don't wear sunscreen, and they're in the office like every 3 months getting laser done. So how often you really need a laser to keep your redness at bay depends on so many factors. And if you are somebody who is investing in lasers, please do yourself a favor and do the skincare, because laser is an investment and you want to protect your investments. You want to make sure you're using all that skincare to maintain your rosacea and keep the flares down so you don't have to do the laser over and over again. Now keep in mind, rosacea is chronic inflammatory condition, so you're going to need to maintain it with topicals plus or minus lasers, but keep that in mind if you're investing in laser to definitely do your maintenance. Remember, rosacea is a complex condition, but the good news is there's so many ways to manage it effectively, whether it's using the right skincare ingredients, avoiding your trigger factors, or seeking in-office treatments, or any combination of all of those. You can keep your flare-ups under control and slow down the progression of the rosacea. So let me know in the comments what's your biggest rosacea struggle, and if you'd like me to dive deeper into specific topics. If you have any questions about products or any topics you want me to cover, let me know below. If you found these tips helpful, don't forget to like and subscribe. You can also find me on Instagram and TikTok at Dr. Aleksandra Brown. Thank you guys for watching. I'll see you next time.